Now, Andrew, this story that has been covered by Sky News at length today off the back of the Nine newspapers story on Medicare, on the face of it, the numbers being reported they sound like a real worry.
It's a big call, isn't it? There have been claims in the Nine newspapers this morning that as much as a third of the Medicare budget could be being rorted as doctors deliberately or accidentally wrongly charge Medicare. Quite an extraordinary claim, but the report is accompanied by examples of crackdowns made by government where doctors had to pay back significant amounts of money. The Treasurer, who has spoken about quarantining health, aged care, defence and the NDIS from cuts in this budget, but has also spoken about the unsustainability of growth in those areas, today said if anyone was rorting Medicare or the NDIS, that person was a grub.
If these numbers are true, it's absolutely atrocious. Every dollar rorted, whether it's Medicare or the NDIS, is a dollar thieved from people who need and deserve good health care. My view is if you're stealing from Medicare or the NDIS, you're a grub.
Well, that's bound to get a run. The language from the Treasurer quite different to that of the Prime Minister.
But obviously, when we're talking about public funds, they should always be used wisely. Overwhelmingly, Medicare is an incredible national asset, and overwhelmingly, our doctors all do the right thing, including our GPs. So I wouldn't want any impression to be got that that is anything but the case. And I do want to give a shout out to those people who are GPs in particular. We don't have enough of them. The idea that we denigrate those people or tar them with this brush is, in my view, entirely inappropriate, because overwhelmingly GPs are out there providing fantastic service.
Well, I don't think the Health Department will be advising the PM today that a third of Medicare is rorted. Health Minister Mark Butler was supposed to give a press conference on this on the New South Wales South Coast, but I believe he had car trouble, Kieran.
Yeah, OK. Well, we'll wait to see if we hear from him at some point. I've got that story covered with one of the experts, plus the Royal College of GPs coming up. So we'll get both sides of that debate.